Hello and welcome. Today we're diving into a rare but serious genetic disorder called cystinosis. We'll explore its causes, how it affects the body, how it's diagnosed and treated, and what the future holds for those living with this condition. So, let's get started on understanding cystinosis. Cystinosis is primarily caused by a mutation in the Cystinosis gene. This gene provides the instructions for making a protein called cystinosin. Cystinosin's job is to transport cystin, an amino acid, out of the lysosomes within our cells. Think of lysosomes as the cell's recycling centers. When the Cystinosis gene is mutated, cystinosin doesn't work correctly, leading to a buildup of cystine crystals inside the lysosomes. This accumulation is what causes the various health problems associated with cystinosis. Let's break down the pathophysiology. The defective cystinosin protein impairs the transport of cystin out of the lysosomes. This leads to a significant accumulation of cystine crystals within the cells of various organs, including the kidneys, eyes, muscles, pancreas, and brain. The crystal buildup damages these cells and impairs the normal function of these organs. In the kidneys, this damage leads to a condition called Fanconi syndrome, which impairs the kidney's ability to reabsorb essential substances like glucose, amino acids, and electrolytes, leading to their loss in the urine. The buildup of crystals in other organs causes further complications and impacts different bodily functions. Cystinosis is considered a rare disorder, affecting approximately 1 in 100,000 to 200,000 newborns worldwide. It affects both males and females equally. While rare, it is more prevalent in certain populations, such as those of Breton descent in France. The signs and symptoms of cystinosis vary depending on the type, but some common manifestations include excessive thirst and urination, which is due to Fanconi syndrome affecting the kidneys. Children often experience failure to thrive, meaning they don't gain weight or grow at the expected rate. Eye problems such as photophobia or sensitivity to light are also common as cystine crystals deposit in the cornea. Over time, kidney failure is a major concern. Other symptoms can include muscle weakness, swallowing difficulties, and in some cases, neurological problems. Diagnosing cystinosis involves several methods. A key diagnostic tool is measuring the amount of cystine present in white blood cells. Elevated levels of cystine strongly suggest the diagnosis. Genetic testing confirms the diagnosis by identifying mutations in the Cystinosis gene. Other tests may be performed to assess kidney function, eye health, and overall organ involvement. Cystinosis is broadly classified into three main types: infantile or nephropathic cystinosis, which is the most common and severe form, onset in infancy. Intermediate cystinosis, also called juvenile cystinosis, features a later onset and slower progression than the infantile form. And non-nephropathic or ocular cystinosis, which primarily affects the eyes and typically doesn't cause kidney problems. Currently, there is no cure for cystinosis, but treatment focuses on managing the symptoms and slowing the progression of the disease. The cornerstone of treatment is cystimine, a medication that helps remove cystine from the cells. Cystimine comes in both oral and eye drop forms. Supportive care includes managing kidney problems with medications to replace lost electrolytes and nutrients. Kidney transplantation may be necessary if kidney failure develops. Regular eye exams and treatments for photophobia are also important. As cystinosis is a genetic disorder, there's no way to prevent it directly. However, genetic counseling and carrier testing are available for individuals with a family history of the disease. This testing can help determine the risk of having a child with cystinosis and inform family planning decisions. The prognosis for individuals with cystinosis has significantly improved with the advent of cystimine therapy. Early diagnosis and treatment can delay the progression of kidney failure and improve overall quality of life. Kidney transplantation can also extend life expectancy for those with end-stage renal disease. Research is ongoing to explore new and improved therapies, including gene therapy, which holds promise for potentially correcting the underlying genetic defect in the future. Continued research aims to further refine treatment strategies and improve long-term outcomes for individuals living with cystinosis.